Thanks for staying with us here on SA Today. Well, violence against children remains a critical challenge facing South African society today. The abuse of children has been in the spotlight during the coronavirus after government implemented lockdown measures to curb the spread of the virus. It shed some light on the impact of COVID-19 pandemic on children. We're now joined by UNICEF's Mayke Huijbregts joining us now. Thank you very much for joining us, and warm welcome to SABC News.
Thank you very much for having me this afternoon.
Let's talk about the work generally done by UNICEF when it comes to children. But I also want to have if you can talk to us about particularly and focus on how you've had to perhaps change your way of working or functioning during this time as we deal with COVID-19 pandemic.
Thank you so much for that question. So UNICEF in South Africa, we provide mainly technical assistance to government and other partners, and we play a big role in creating awareness about the situation of children. And we provide advocacy support, create awareness, and for example, we are advocating for the Office of the Rights of the Child to be returned back to the Office of the President, so that children are really at the center of all decisions pertaining to policies and budgeting for children. We are working with the Parliament to train members of Parliament on child rights and child protection issues. We have an agreement with the South African Human Rights Commission to really monitor the situation of children in the country. And we work with the line departments as social development, education, health, home affairs, to really make sure that children have access to quality services throughout the life course. Then what we are doing, we are providing direct support to children by working with a range of civil society organizations. For example, we are working with Childline. They have 86 counselors, and they have been operating for 24/7 during the COVID to receive calls from children as their levels of anxiety and distress were augmented. And we are working with the Red Cross to provide direct relief on the ground, with ACT, with the National Association of Child and Youth Care Workers, to really accompany children in distress. As well as we are working on the strengthening of families with partners like Sinovoyo, Men Care, Heartlines, to really create a nurturing and care environment for children. What we had to do differently during lockdown is to completely move virtually. So basically our education department worked tirelessly with the Department of Education to really support the move from physical learning to online learning, radio and TV programs for learning. And we set up hand washing stations at no speed in order to make sure children had access to safe water. But primarily we mobilized an incredible campaign in order to teach children how to protect themselves from COVID infections in terms of hand washing and hand masks.
Yeah.
So basically we had to change course and adjust our way of working.
Yeah, I understand. In terms of, the fact that we still do see in South Africa a lot of child abuse, you're giving this technical assistance, and I wonder what are the gaps that you've been able to, let's say, identify, given the fact that these numbers continue to be so high of children that are so badly affected by child abuse. There must be some sort of gap, otherwise we wouldn't still be having the huge numbers that we're having. And what have you identified as you give that technical assistance to, as you say, government and other partners, whether it be Childline, etc.? What have been those factors and perhaps the tools that those partners you work with can then use so that we don't see the level of child abuse that we're currently seeing in this country?
Thank you for that question. Violence overall has been very high in South Africa for a very long time. So what we are coping with and the drivers of violence is really an intergenerational cycle of violence against women, and children that we have to break. However, now, as a result of COVID and lockdown, we saw that households have become more poor. We have seen more people becoming unemployed and losing their livelihoods, as well as hungry. And unfortunately, we understand these drivers to violence have led to more violence and abuse against women and children. So it will be very important for us to really address violence prevention and early interventions holistically, by expanding a social protection floor to decrease the economic distress that households are facing as a result of loss of livelihood, and of course invest in job generation as well as family strengthening, and really accompany these caregivers with concrete tools like parenting, involvement of men as fathers in the care of their children, as well as men care programs, and really ensure that these families are strengthened to empower them to create a nurturing care environment with having enough economic means to take care of these children, but also really are part of healing programs and psychosocial support programs to decrease the levels of distress and to enhance quality dialogue in the households.
And Mayke, just to ask you, I want to find out how are you able to rather identify those households that perhaps do have children in them that are vulnerable and do need your help? I don't assume that children are able to reach out all the time to organizations like UNICEF or call Childline, for instance, and some of the most abused are children that can't even communicate for themselves. So I wonder, how is it possible for UNICEF and all your partners, maybe I should put it that way, to be able to find out the reality on the ground? Perhaps what we're seeing isn't the reality. Perhaps it's even deeper than what we see on the surface, what we report on, perhaps here on SABC News. So I just wonder what are the mechanisms used in order to then identify those households that would need this essential service that you provide?
So the households that are most at risk are children living in poor families, children that live in families where adults are unemployed, or children in migrant families. We also see children with disabilities at intensified exposure to abuse and violence. Yeah. So we are working with a whole cadre of social service professionals, with DSD and the Council of Social Service Professionals, and with NACCW through a whole cadre of child and youth care workers who are working in the life space of families at risk, and they know which children are vulnerable and need to reach out. What indeed is true, during lockdown, it was the older children that reached out to Childline and to other helpline organizations, but it was the younger ones that got trapped into a situation of observing, witnessing abuse and violence, and not being able to reach out to their kindergarten teacher or to their peers as a means to cry for help. So it's very important to create a nurturing care framework around the poorest and most marginalized families that are at risk, in order to make sure we monitor the well-being of these children and timely identify signals of distress to prevent and early intervene. And for example, the ECBNI Child and Youth Care Program has been very successful in doing so through home-based care visits, and they moved to virtually doing WhatsApp counseling with families and children at risk during lockdown.
All right, Mayke, a pleasure speaking to you, and thank you for giving us your time here on SABC News. In fact, we will continue the conversation as we speak to one of your partners from Childline. So thank you for this and the work that you're doing at UNICEF.